Hi everyone, and welcome to our PD medications webinar, freezing webinar with Dr. Jean Doan. My name is Sherry Bauer-Gagné, and I work as a client services coordinator of Alberta out in the Lloydminster region. If you have any questions during the webinar, please submit below in the chat, and at the bottom of the screen, there's a little blurb icon. And click it, and the chat will appear, and on the right hand side, and you can send your questions out to the whole group or just to the panelists in the drop down arrow. This disclaimer, this webinar will be recorded. All information provided in the videos by Parkinson's Association and featured speaker is furnished strictly for the education and entertainment purposes. This service is not intended to be diagnostic, prescriptive, or replace a relationship, advice, and or care of your physician. General questions about symptoms, treatments, available medications, complementary healthcare therapies, etc., and current researches are fielded as well. In our third installment of this series, we introduce you to Dr. John Doan. Dr. John Doan is presently an associate of a professor in the Department of Kinesiology and Physical Education at the University of Lethbridge. Dr. Doan's research combines mechanical and biological engineering with kinesiology and neuroscience to focus on measuring and interpreting the interaction of the human perceptions and the actions at work and at play. His current research explores main topics of perceptual base of occupational overloading and soft tissue injury, and exercise therapy, biomedical devices for rehabilitation amongst people living with Parkinson's disease. That's a lot of words, big words for me. Welcome, Dr. Doan. We're really happy to have you with us this morning.
Great, thank you, Sherry. And thanks, Nicola, for getting us set up here as well. And thanks for Brandy for reaching out to me as well. It's a real pleasure for me to give a presentation with Parkinson's Association Alberta today. We've been working with Parkinson's Support Group around Alberta in the lab for 20 years now. And I've had an opportunity to visit a number of groups and to work with a number of people living with Parkinson's disease, both in our lab and in facilities around Alberta. As you'll see through the talk, one of the places we show up often is in hockey arenas. And I've had a great chance to get on the ice with people living with Parkinson's and their caregivers and arenas around Alberta and around Canada, actually. So I'm going to share my screen here. Just before I do, I don't want to self-handicap, but I will say I have two rambunctious children and two somewhat rambunctious dogs. So if you hear some noise in the background, don't be too alarmed. So I'll go to share my screen here. All right, so hopefully everyone can see my screen online. So I'm going to go through a bit of a presentation here, talk a little bit about this topic, which is unfreezing exercise. And well, I will talk about freezing of gait and how exercise and activities may be a way to break that freezing. I'm using unfreezing a little bit larger here in the idea that we need to find the right exercises, both the why, the what, and the how of exercise to be most helpful for Albertans living with Parkinson's disease and their partners and caregivers as well. I'll introduce you to the image that's on the screen here as well. This is a client that we've worked with in Vancouver, actually, named Richard. Richard had a chance to be a part of Parkinson's BC's advertising campaign around Faces of Parkinson and Parkinson. And he chose to pose for his photos with his hockey gloves and stick because he really likes the exercise and activity of skating as part of his physical and mental health. And I was excited. Richard has been one of our participants in the skating program, so I was excited to see that he was interested in encouraging others that way. So this was a bus ad. This program also featured on SkyTrains in Vancouver and several other places as well. So we're all familiar with the message that exercise is this major influence on our health, and certainly an abundance of research shows that exercise can improve cardiovascular function. Exercise can help maintain or improve muscle mass, which can be important for maintaining health and avoiding illness. Exercise improves connective tissue tolerance. It maintains bone density, maintains metabolic function, and it can improve psychological function as well. And again, the abundance of research here led the American Medical Association in 2008 to come up with the statement, exercise is medicine. And certainly many groups, Canadian Medical Association, medical students across Canada, Canadian Society of Exercise Physiologists, all sorts of groups have really bought into this premise that exercise can be and is medicine, and we should be thinking of it in this dose treatment sort of analogy to medicine. For us in the world of Parkinson's, it's important to note that along with these musculoskeletal and cardiovascular system changes, exercise can change the central nervous system as well. And again, our current research is showing that exercise helps release neurotrophins. It drives or maintains neuroplasticity, so connections of the central nervous system, and it promotes functional changes inside that system as well. And I like this recent review from Alskog, this is specifically aerobic exercise. We'll talk about types of exercise here in just a minute. Alskog's interested in aerobic exercise, but uses a multitude of different studies and researches that rolls in here together to get to this really, I think, important take-home message for us, that these extensive and diverse avenues of scientific investigation all come together to tell us that aerobic exercise and cardiovascular fitness directly influence cerebral mechanisms mediating Parkinson's disease progression. So we can use, in Alskog's version, aerobic exercise and cardiovascular fitness. Other people study other forms of exercise or combined forms of exercise as well to help to mediate the progression and development of Parkinson's disease. So the question comes up then, what to exercise? And in my mind, this is really where kinesiologists, people in the world of phys ed like myself, can start to make or can help to make a valuable contribution to this discussion. There's no question, there's no debate that exercise is helpful for us, and regardless of our neurological condition. And so the question is, what are the best exercises? What's the best approach to exercise? And then how can we maintain that as a behavior? Everyone knows we should exercise. How can we get ourselves to do it? And what should we do? And a really nice recent review from Bausa Machado and colleagues here had a look at physical activity, exercise, and physiotherapy in Parkinson's disease. Starting to understand, or starting to break out here then, if we know that exercise is medicine, we have this multitude of research that's shown us about healthy doses and types of exercise, are there specific considerations for people living with Parkinson's disease? And this is a busy table. Don't worry, I'm not going to ask you to copy things down here. But I just want to use as a place to show that we have a number of different elements of exercise that are showing up here. But the takeaway from Bausa Machado's research is that the exercise prescription for people living with Parkinson's disease is the exact same as the exercise prescription for people without Parkinson's disease. We need to think about exercise in terms of the FIT principles. So what's the frequency? What's the intensity? What's the type of exercise? And what's the time for exercise? And then we need to provide, if we want to maintain musculoskeletal health, cardiovascular fitness, and psychological health, we need to tap into exercises of are typical different categories. And while they have some details on those categories here, we can summarize like this. We want exercise to have some endurance component. So that's working the muscles and the cardiovascular system for a good length of time. We want to have a resistance component. That's working the musculoskeletal system against load. We want to have a flexibility component. So that's letting the musculoskeletal system stretch and work through a range of motion. And we want to have a balance and multi-component training. So this is the more functional aspect where we want to think about, are there specific skills that we want to reinforce or use to reinforce activities of daily living? And it's interesting. So Machado's paper came out in 2019. Interesting, more than 20 years earlier, this really groundbreaking study from Colleen Canning and Associates came out. And this is one of the early empirical or numbers-based looks at exercise amongst people with Parkinson's disease. And so Canning had a group of participants in her study, people living with Parkinson's disease, some who self-reported as being sedentary, some who self-reported as being regular exercisers. And for that group, she measured one of our typical outcomes for measurements for exercise, which is this predicted VO2 peak. So can we use a fixed treadmill or other type of fixed test to figure out what we think your fitness level or your gas exchange level and fitness looks like? And she showed, if we look at the graph on the left here, Canning group clearly showed that people who were active, Parkinson's patients who are active, were enjoying the outcomes of that activity, which is better cardiovascular health. They had this higher predicted VO2 max. What the two, I mean, that's valuable information for us, right? It gives us this evidence that yes, we should keep exercising even after the diagnosis of Parkinson's disease. The two really interesting carry-ons from that in Canning's study. The first was that the activity level was not limited by clinical status. So along the bottom of the graph here, we're talking about Hoehn-Yahr scores of 1, 2, or 3 for disease severity. Right? Along the vertical part of the graph, we're looking at still that predicted VO2 peak. And Canning's study showed that people who were active were still hitting those higher VO2 peak predictions, regardless of whether or not they were in disease severity 1, 2, or 3. So there are no limitations through the Parkinson's disease and their clinical status, right, this Hoehn-Yahr score of 3, that kept them away from either being active or achieving the outcomes of activity, which are cardiovascular health. In this case, measured as cardiovascular health. I think, for me and for my lab anyways, the real takeaway from the Canning study when we started to work with this was a little bit of a hidden list right here, which is in the center of this. So this is a table from the paper that looked at all the participants. And for those who were the active exercisers, Canning's group asked them what their typical mode of exercise was. We can see that column right there. And there's two interesting pieces here. Remembering this paper came from 1997 when the concepts of using physical activity as management for progression, of Parkinson's disease was fairly new. Right? So Canning's look said, no, I think every one of, I mean, I guess I need to double check, but I think every one of these participants said walking is part of my physical activity package. And that's really led research and prescription in a specific direction for the 20 plus years since this paper came out. Walking is a pretty common recommendation for the exercise modality for people living with Parkinson's disease. But if we dig in a little bit deeper here, we'll see that over half of these participants, along with walking, list another physical activity or mode of exercise. And in fact, some of these modes of exercise are fairly vigorous compared to what can be the typical prescription or recommendation for people with Parkinson's. Now, Canning's group is in, I can't remember if it's New Zealand or Australia, sorry, but in an area where things like water polo and bushwalk or hiking may be a little more common. But you can see that participants are reporting swimming, cycling, tennis, squash, all sorts of activities as part of their mode of exercise. And this paper then makes a jumping off point where we can say, well, let's look for understanding that exercise as a prescription is useful, right? But maintaining exercise behavior can be a little bit challenging for people. Let's look for exercises that interest the population. Well, let's go away from walking is a great start, right? And certainly a functional behavior that we want to have for many of our activities of daily living. But if we want people to exercise, we need them to enjoy it, right? And so when we think about what to exercise, then we can start to think about activities that we can enjoy that may also be helpful. And this is a great new paper out from a global sort of research group, including Mark Halligat from Oregon Health Sciences University, Bas Bloem from the Netherlands, a great group here looking at compensation strategies for gait impairments. But it's interesting that the compensation strategies here, so many of them are physical activities that really could be our exercise package. And so the paper is a thorough review, but one of the nice outcomes of the paper is this poster of these 55 different detours from freezing. Again, they're talking about compensation for gait impairment. But as I'm going to point out, so many of these detours are exercises that we could make part of our physical activity for maintaining the progression or mediating the progression of Parkinson's disease. They sort of serve this double purpose. They may help you break up freezing of gait if you use them as an immediate strategy. And we'll talk about some strategies here in just a second. But they also could be the basis, if this is something you enjoy, this could be the basis of your exercise program as well. So let's zoom in on a couple of these here. Sorry, maybe my video screen is over the top, but we can start to see then that these exercise behaviors are these compensation strategies are things like jumping. In the picture they're showing here from stone to stone, but it could be a jumping exercise programs, walking while bouncing a ball. Fencing is something that gives us a different set of steps. Cycling, upholding or sort of moving a football with our feet, stepping over something visual, walk cycling. So if we're not fully balancing on a bike, maybe we're using the bike as a bit of support while we walk on both sides of it. Kicking something that's in front of us, the target, lifting the knee very high. All these things, again, compensation strategies to break up freezing a gait, but also things that could be the basis of an exercise program, if that's an activity that you enjoy. Right? If you like cycling, then let's make, and you do that safely, then let's make that the basis of your exercise program. Right? If you're interested in stretching behaviors, then let's look at this lifting the knee very high as part of what could be your exercise package or the jumping. I was very excited to see that this group had included, sorry, I know these are a little bit small, ice or roller skating. I haven't done as much about roller skating, though I have seen some very interesting examples of it. We have done some roller blading, but ice skating is this opportunity, and we've seen lots of examples of this being a compensation strategy for freezing. We have research evidence that shows that it breaks down freezing, but we also think it's a great form of exercise as well. Certainly most Canadian communities have an arena in them. And skating is this great opportunity. If we go back to that list of training types that we want to bring in, skating is something you could have an endurance component to it. You could have a resistance component to it if you did some skating against load. It could certainly bring in some flexibility pieces if we made some of these high leg movements and lunges and all sorts of things while we're skating. And obviously it's balance challenging as well. And I was excited to see the group included ice skating here because as far as we know, University of Lethbridge is the only center in the world that's examining ice skating amongst people living with Parkinson's disease. So if we accept then that exercise is going to be an important part of mediating the progression of Parkinson's disease, and we're comfortable with the idea that exercise can be elements that we enjoy and do safely as long as we can find ways inside those pieces to bring in some of the endurance training, some of the resistance training, some flexibility pieces, as well as balance and multi-component. And the question is how to go about and actually do that exercise. And I'll come back then to the Nonique's paper here, this compensation strategies, because along with these 55 detours from gait impairment that I suggest many of them would be good exercise if they're enjoyable for the group as well. They talk about 7 different strategies then, or 7 different categories that these strategies fall into, things that are ways to exercise or how to exercise. And so let's break down a couple of these right now. The first one that they talk about is external cues. So in their study, they're saying external cues that are inside these compensation strategies, things that help us break up the freezing of gait, are things like auditory cues, usually rhythmic, visual cues that may be a single visual cue or rhythmic visual cue, a somatosensory cue, so that's something that touches you on the skin and gives you a bit of a cue there. And really these external cues are about this, as the paper shows us, something that gives us from the outside a cue to make a movement. These same sort of strategies that are useful for unfreezing the gait, right, or giving you information on freezing the gait, can also be great cues as well for exercise, right? If we want, again, to maintain an exercise behavior that's got that endurance piece in it, that's us making step over step over step, exercising the musculoskeletal and cardiovascular system over time, then we can use this cues approach to help drive that exercise behavior. Exercising with music, specifically music that you like, exercising or moving with a metronome, right? Or using visual cues on the floor that remind us to make big steps. All sorts of things can be part of our exercise program that really allow us, again, to satisfy those exercise goals. Internal cues are their next category inside here. Again, things that we want to find these strategies in. And again, exact same logic works for our exercise behaviors like it does for these unfreezing strategies. Right? We can use internal cues, so focus on a component of the behavior. Let's really focus, use mental attention to think about making big steps, or knee flexion, or whatever sort of parts we want to bring to it, or some self-prompting and all sorts of things. And we can use those same internal cues for our exercise as well. I will say, I'm going to cheat maybe a little bit on the paper here and say I want to stretch internal cues out to the psychological side as well. Can we use some internal motivation cues to help us go through our exercise behavior as well? Right? And specifically thinking about this idea of a trigger for a start. And one thing that's great in the exercise world for motivating our behavior are these wearable activity trackers. So things like a pedometer that we count our steps, a Fitbit that may look at the rate of those steps and some of our other information. All sorts of different wearable activity trackers that can give us this trigger and say, oh, time for me to start exercising, and time for me tomorrow to add 200 steps to my exercising. I do want to suggest for people that wearable activity trackers are about encouragement for exercise, and they can become a problem if they're discouraging for your exercise. If you're setting unrealistic goals, or if you are challenged to get some exercises in one day or through several days, and your wearable activity tracker then is giving you a bit of a negative feedback, obviously that's not helpful. Right? That's not our suggestion for the activity trackers, is to beat yourself up over it. It's for people who do find benefit from the feedback of, oh, what did my steps look like? How many did I get in? How big were they? How long did I go? Then these can be really useful information that, again, can be that trigger, internal trigger in a way, for some activity behavior. And there's lots of evidence out to show that activity trackers work well for people living with Parkinson's disease, and it can really be an important or useful contribution to your exercise program. Two other elements from the compensation strategies papers are this idea about altering the mental state and motor imagery or action observation. So again, remembering this paper is about general strategies or not general, mechanisms of strategies for breaking up freezing the gait. We may have an idea about how altering the mental state and using motor imagery would work there. But again, I would suggest the exact same ideas or concepts relate to maintaining our exercise behavior away from frozen gait, or just as a behavior as well. Work here. So altering the mental state, then the authors are talking about things about limiting anxiety, decreasing fears of falling, and increasing motivation, and talk about the motor imagery piece as an opportunity to activate the mirror neuron system. So, excuse me, this set of mirror motor neurons that fire when they see an activity that we're familiar with, that we know how to make, and may make some reinforcement of the motor neuron system. And I think both of these, in the world of exercise, I think both of these techniques are satisfied, certainly this increasing motivation piece, with group exercise. Again, most of our research, and this would come from exercise psychologists for the most part, though other people in the world of phys ed would look at group exercise as well. Most of our research tells us that group exercise, when the group is like-minded, has a similar goal, and is of fairly equal physical fitness capacity, has that sort of commonality at their base, group exercise can be incredibly motivating. And I don't know if I can encourage enough finding an opportunity to exercise as part of a group that is reinforcing and encouraging. It really alters that mental state, right, as I said. And it also gives you a chance for this motor imagery piece. Well, I can see other people do these exercises, and I can start to understand what the battle ropes look like when it's done with good posture. I can start to understand what big steps look like. I can start to understand how quickly people may use their upper extremities to punch a bag. Right? If we talk about some common exercise modalities are on the go right now. One challenge that exercise specialists identify, we often work with interventions, right? For a fixed amount of time, we'll give a certain set of people a specific dose of exercise. We'll look at all these great outcomes. Look at what we've done for musculoskeletal health. Look at what we've done for cardiovascular fitness. Look at what we've done for psychological health. And then we're done, right? The intervention's over. And that's not on for the real world, right? That may be fine for researchers. In fact, it's not fine for researchers, right? We know this is a limitation. But we really need to start to understand what makes group exercise and exercise behavior in general last as well. And I love the title of this paper, and it's published by a dear old friend, Mark Beauchamp at University of British Columbia, along with some graduate students. What happens when the party's over? How do we maintain this exercise behavior after that special exercise attention that we got or that we gave ourselves has come to an end? Right? And what the Beauchamp paper here has found is that intervention, right? So remembering that along the path of the presentation where you said, yes, I understand exercise is important. I'm going to make it part of my medicine. I now understand that I can look for an exercise type that fits me. If I like skating, I'm going to find a way to go skating. If the boxing interests me, I'm going to do the boxing. If it's walking in water, take some of the gravity off. If it's cycling, if it's walk cycling, whatever it gets to be, I'm going to find a way to bring that exercise and maybe some other pieces into my exercise package as well. It's important then, as you're starting to make that, as you're starting to bring exercise into mediating the progression of your Parkinson's disease, that you understand there needs to be a behavioral change in there as well. And it needs to be an intentional and sort of planned out behavioral change. Inside these interventions or inside an exercise program, it's important for the group and hopefully through a knowledgeable group leader to start to say, hey, you know what we're doing here is a new behavior for us. We need to keep it going. Even after this group stops meeting or I'm going away for summer vacation, I won't be coming to yoga class, whatever it gets to be. Inside the intervention, we need to build in this behavioral change so that we maintain that behavior afterwards. And this is another piece where this unfreezing pops up as well. There's in some of my classes, when we're talking about exercise or change in general, we use a couple different models for change. The one I'm showing here, unfreezing, changing, refreezing, comes from a researcher, a psychological researcher named Lewin, last name Lewin. And it's really about how to make this behavioral change, right? It's about unfreezing what was a behavior that we want to change. So it's saying, you know what, I wasn't getting enough exercise in, or the exercise didn't tap into these categories, or it wasn't something I enjoyed, whatever it is we need to change about that behavior. Then making the actual change and making that new behavior our regular habit, right? And so our exercise interventions, if we start to go to the gym, if we start to go to boxing class, if we take up a spin class, if we join yoga, if we start swimming, whatever it gets to be, in parallel with making that exercise change, we should intentionally be making this behavioral change, saying, hey, I know why I'm doing this. It's important for my health. I'm going to keep doing this, and then find ways to make that happen. It's a really important part of making exercise last. And I'm happy to talk about that more with the questions in the end. So let me conclude here. Sorry, maybe I've been missing my classes. I slipped that into a bit of a lecture there. But I'm really happy to answer some questions at the end. But let's definitely bring in some conclusions here. Right? So if we want to conclude about the why for exercise, right, we can say all of our evidence shows that exercise is an important part of biological health, psychological health, and social health for everyone. Right? If we are interested in maintaining our health and taking a medical approach, let's say, or a big picture look at what is medicine and good for us, exercise has to be the number one feature there. You must have this piece, some level of physical activity to maintain these things. Right? Whatever the level that we can achieve right now, we need to be consciously doing that and conscientiously doing that. The best exercise dose then, if we want to maintain, if we want to keep doing this behavior, right, and enjoy it, needs to be fairly vigorous, right? Needs to be of a meaningful length, and it needs to be a physical activity you enjoy. And again, I really like that Nonique's paper with their 55 different detours from freezing as places to say, well, not only is this a great way in an instant to break up freezing, but I like basketball. Why don't I make dribbling a basketball and some of the things around basketball behavior, like jumping, like stretching, like a little bit of sprinting or fast walking? Why don't I make that part of my physical activity, my exercise package? Because that's what I like to do. And maybe other people I want to exercise with, maybe that's what they like to do as well. My kids, right? My friends, who knows? So the best exercise dose, if we're thinking of medicine, needs to be this vigorous piece, right, of meaningful length, and to stick with it needs to be something you enjoy. And the last conclusion here then, if we want to support that exercise, exercising with cues, either external cues or internal cues, exercising with feedback, which can be this internal cue or motivating piece, right? And exercising with others, which can help alter our mental state. It brings in some increased motivation, helps break down anxiety. It can all really improve then that frequency, intensity, because it's easier to achieve exercise goals when we support our exercise with these other pieces. Thanks so much for joining us today. Really happy to be together with Parkinson's Association of Alberta today, and looking forward to your questions.
All right, I have one question so far, and hopefully we'll have a few more. Could you please clarify in the unfreezing, changing, and refreezing framework what the refreezing refers to?
Sure, great question. Refreezing is making whatever that change behavior was, is making it your new normal, I guess. A bit of a pat phrase, but let's put it in there. So as I said, I use this example in classes a fair bit. So I'll give you the context there. Along with movement disorders and some other things, one of the things that I teach is about ergonomics. So health and safety at work and making changes to make work safer. And one of the things we say there is that if we want to change workers' behavior, right, if we bring in a new technique to lift a box, put on a piece, we first need to say, hey, you know what, I know you've worked here for X number of years and you've always done it this way. Here's why, you know, the evidence shows that may not be the safest way, and maybe you felt some of the discomforts when you lifted things that way in the past. Let's try this new behavior. And then the refreezing piece is making that new behavior the new normal. Right? So in the exercise world, the refreezing piece is saying, you know what, my unfreezing, the thing I was doing was walking fairly slowly for a short duration 2 times a week. My changing is recognizing, hey, you know what, I need to make that walking a little bit more vigorous. I maybe need to add a little bit on the time, and maybe along with walking, I need to add some resistance training, or on the days I don't walk, some stretching at home, or maybe a little bit of both of those. My refreezing then is now making those my new exercise behaviors and maintaining it.
Awesome. Thank you. Is there any more questions out there? Please feel free. Well, that was a lot of great information. I really appreciate that. I'm definitely going to be taking a lot of these things forward. Yeah, I really liked helping to maintain the exercise, building a habit, and learning those tools to help you stay, you know, cognizant and thoughtful about what you're doing. All right. Any more questions, ladies, gentlemen out there? All right. So, oh, what do we got here? Barb asks PDF for slides. Is it possible to get that?
Yeah, sure. All
right. So if you can just forward that through, and I'm not sure how we'd be able to do that. Possibly.
I'll send it to Brandy.
Okay. Perfect. Maybe we can find a place to post that, or Barbara, if you've got a client services coordinator you're attached to, please contact that person and we can get them to you, okay? All right. That's it for questions. Okay, thanks, Dr. Doan. Thank you for joining us with this valuable webinar today, and thank you all for joining us. We really appreciate your time. For our next scheduled webinar is May 13th. For more information, you can visit our website at parkinsonassociation.ca, and you can also follow us on social media. All our webinars will be shared on our YouTube channel and on our website. So contact your client services coordinator if you have any questions, and we'll definitely help you out and send you in the right direction. And if we don't have the answer, we'll definitely get it for you. All right. So we'll close for now, and thanks again. Have a great day, everyone.